Amandla, a lot of research that you've done about the poor, about the informal sector, about what happens to them in this kind of situation. What should we be doing about them? You've also done a lot of work on the international assistance that Africa may be requiring. Can you share with us the outcomes of your research in these areas?
Absolutely. Hakeem, thank you so much for having me. Now with your hat as professor, it's a real pleasure to be here with you all today, and Teresa for gathering us so professionally. So I'll get started by a brief way of introduction. I'm an associate partner in the Nairobi office of McKinsey, and my work is actually at the center of the question on the informal sector. I spend most of my time in agriculture and food. And as you all know, agriculture, of these approximately 300 million informal sector workers across the continent, more than half of them are farmers. Moreover, the average African is spending 50 to 60% of their income on food. In poor economies or in poor parts of the continent, even more. And most people are buying their food in informal markets. 60% of our population are there. So my work is really at the center of understanding informal sector markets in agriculture. Allow me to take you on a bit of a journey, Professor Hakeem, as you've inspired me, to do a bit on the healthcare imperative and a bit on the economic imperative. Every couple of weeks, we're surveying over 1,000 Africans, testing their consumer sentiment, testing financial decision-making. Between my colleagues and I, who were co-authors of the report that I'll refer to a lot here, any given week, we're speaking to dozens of ministers, CEOs of large corporations, leaders at the forefront, SME leaders at the forefront of this crisis. And so what I will share is informed by conversations we have with them every single day as well. If I can have the first page. Professor, allow me to indulge a little bit in the context, because I think it's helpful to orient ourselves in the order of magnitude that we're talking about on the impact across the continent. The pandemic is indeed progressing at a slower rate in Africa than other regions, but our rate of testing is incredibly low. So across the continent, we've seen just north of 3,300 cases. These numbers are from last night, confirmed across Africa, compared to 1.2 million in Europe. Europe has about twice the population of Africa. However, Europe is doing testing at a rate of 10 times the best testing we're doing across the continent. So for Africa's 1.2 billion people, we've tested approximately 600,000 individuals. This equates to, in our best country that's doing this in South Africa, 5,000 to 6,000 tests a day. Whereas in Germany, which has a population slightly more than South Africa, they're doing 50,000 tests a day. So we don't know how much the virus has spread, even if we've not seen the takeoff that happened around week 4 to week 6 in a lot of European countries. It does present an opportunity for us as we think about protecting lives across the continent. Testing strategies vary wildly. And as lots of people, the governor have reiterated, Professor Mushfiq has reiterated, our critical care capacity is very low on the continent. There's a lot of things that we've learned over the past 10 years around diagnostic testing, given the fights we've had with HIV and tuberculosis, for example. But critical care capacity is what overwhelms the healthcare system with regards to COVID. So we have about 1.7 ICU beds per 100,000 people in Africa. China is at 3.6. America, that is really struggling, is at about 30 ICU beds per 100,000. So we cannot afford for the crisis to get to a place where our healthcare system is overwhelmed. Now, as we think about testing, we started a lot of these lockdown measures early. We've had advanced warning. Testing is a really critical part of that strategy. And we get asked a lot, how much is it going to cost to prepare our healthcare systems for this crisis? And the big answer is it depends, right? So as I mentioned, we're at 500,000, 600,000 tests today. If I follow the first row of small bubbles that you see on the page there, that assumes that our infection rate stays at 0.1%. To give you a sense, this is about a third of Spain's infection rate 30 days into the virus. Then if we just do essential testing, that's testing prioritized for patients with defined symptoms, that requires 5 million tests. If we were to do broad testing in the bottom row, where we would have less robust containment, 1% of the infection rate of the population, this is about what New York City saw in the first 30 days, then we need 300 million tests. The order of magnitude here is significant. And the way we're encouraging governments to think about this is build capacity now, right? The 500,000, 600,000 tests is not enough. We've estimated a cost of about $5 billion at a minimum to get us prepared for the less robust containment stage of things, getting N95 masks, getting surgical masks, getting the tests, getting the ventilators required in the next 100 days. And so even as we think about protecting lives, it's really, really important to ramp up the healthcare capacity, but also really ramp up our testing so we can get a real sense of where these numbers sit. If I could have the second slide and take you a bit to the question of livelihoods that we've all been discussing. What you see on this page is a structure of the employment across the continent. Approximately 440 million Africans are considered to be in the workforce. About 40% of them, more than actually 50% of them or so, are self-employed. Most of them are in the informal sector, and a further 40% of them are employed by SMEs. So it's really important for us to, as we think about jobs in particular, think about the impact on SMEs. And the SMEs I'll talk about over the course of the next couple of minutes are SMEs that are employing 2 or more individuals. The threshold in a lot of countries actually that we've looked at is about 10. We recognize the enormous amount of the hustler SME, but the interventions there look a bit different, and I'll talk about that in a second. This is the structure of our economies. If we were to have a look at the next slide, we've done a fair amount of analysis to understand what the impact of COVID could be in jobs, both in the formal and the informal sector. And the top line story is this. Regardless of formal or informal sector jobs, about a third of the jobs across the continent are likely to be affected by the crisis. In the case of the formal sector, about 20 million jobs are at risk of being lost, with another 30 million or so at risk of having a reduction in salary, reduced working hours, and other effects on employment that don't necessarily require job loss. In the informal sector, where we have these 300 million individuals, as I mentioned, most of them actually are smallholder farmers, we expect 100 of those, so again, another third, to be rendered vulnerable as a result of the crisis. Happy to talk about in Q&A if you're interested, all the various ways we cite these numbers, but it's quite a significant portion of individuals in our informal sector that need their livelihoods protected. If we could quickly go to the next slide. What's important to understand, even as we think about balancing the livelihoods and the lives, is that we've asked for a significant fiscal stimulus from the international community that we hope will trickle down to the SMEs. The order of magnitude we're looking at is about $100 to $150 billion that has been requested on behalf of ministers of finance across the continent. These numbers are big, but they're still not enough to bridge the gap that we expect to see in GDP growth, and therefore the impact that this will have on jobs. In the best case scenario, we think we can maybe close half of the gap that you're seeing that's affecting these 150 million jobs, but there's still a long way to go. African governments are spending approximately 20% of their government revenues doing debt repayment. So there's a question of getting money, there's a question of all the money that's actually leaving our economies that's not going into a fiscal stimulus. What does it mean to spend 20% of your government revenues servicing debt? For a country like Angola, it means that Angola is spending 6 times more money servicing debt than investing in the healthcare system. So while we think about fiscal stimuluses, there's also questions about getting into a debt standstill on some of the sovereign debt that's owed, as well as some of the private debts that's owed on all of our Eurobonds. And so that gives us a sense of the fiscal stimulus that would be required to mitigate some of the job impacts, but it will only make a difference if it actually reaches SMEs. Professor Mushfiq started to speak about this a little bit, and I would separate the SMEs into 3 categories. The essential services SMEs, which Governor Nasir talked about. These are people providing food services, providing PPEs, and making sure that they can stay open. The pressures we're hearing in that segment of SMEs right now is around cash pressures, working capital, their loan repayments and credit terms. In Kenya, about 25% of SMEs that fit into this bucket are closed already. And another 30% are concerned about being able to survive past 30 days. And so that category of SMEs that are providing essential services need quick infusions of cash. And I'll talk about in a second what that could look like. The second category of SMEs are those that are supporting significant number of jobs. If we think about the impact of the COVID on our informal sector economies, we need to think about stimulating the SMEs that are providing a lot of jobs. This will differ enormously by sector. I'll take the example of tourism in Kenya. Tourism has received an incredible hit from COVID, right? We've just seen flights, things completely shutting down. The number of jobs in the tourism sector, though, is much less than in something like retail. And so governments are having to think about where are the jobs, therefore, how do we mitigate the biggest level of impacts? The third category of SMEs are then the hustlers we talked about. The kind of support that's required is somewhat financial. So when we talk about increasing working capital, we're thinking about ideas like the government actually providing support to SMEs that are, or large businesses actually further up the value chain. So in agriculture, I would think about a large producer of seeds or of crop protection. It's a big company where lots of small SMEs would go to this inputs provider to get their seeds and their crop protection. It's actually easier to target that slightly larger company to then provide support to these SMEs so we can make sure it gets directly to the SMEs that require it, with some conditionality on protecting the jobs of those SMEs is one way to try and get very, very targeted with this group of SMEs. The other way is actually operational. So it's not just financial challenges we're hearing in these SMEs, but what does it mean to do social distancing in an open market? It's super challenging in some markets in Western Kenya. If you can decentralize and do what you're seeing, we're seeing Governor Nasir is able to do, and move markets into schools or open stadia, that's great. There are lots of places where you can't do that. So do you have alternating market days so that you have half the capacity of people in your open market at any given point in time? Do you change the supply chain and logistics so that rather than delivering between the farms and the market, could these trucks become a collection point for where you do this? There's a lot of operational support required as well when we think about the SMEs. And so finally, let me leave you with this last point around balancing this health imperative that I talked about, where it's really about our testing strategies and ramping them up, and this economic imperative of keeping SMEs open and maintaining jobs. What you see on the slide in front of you is a matrix that on the y-axis looks at strategies to protect the general population. So all the way at the top, on the y-axis, you see a full lockdown, and we have countries like South Africa that are at that end of the spectrum. At the bottom, you see social distancing and physical distancing measures. Most African countries are actually, I think it was just Burundi about a week ago that hadn't imposed actions beyond physical distancing, but most African economies are really thinking about the y-axis. And as the president of Ghana mentioned, we started going up the axis, and now we're thinking about coming down the axis as we try to control the virus spread and we have a handle over test growth. We're really encouraging governments to think about moving along the x-axis. And the x-axis measures protection for those at risk of getting the COVID in the most severe manner. So those are people who are elderly, which is a smaller segment of our population than in the West, as Professor Mushfiq talked about. But it also includes people who have immunocompromised health systems. So we're still very unclear about the impact of the virus with comorbidities around HIV and tuberculosis. So we're really encouraging governments to think about moving on the x-axis. And this is what the impact is. If you start at the bottom left of this chart, the pink box, this is assuming, this is where we were in Kenya at the beginning of March, that there was requests for people to have physical distancing, but by and large, the economy was operating as is. And you'd see 100% of economic impact. You'd also see about 100% of potential cases if you're open. If you move all the way up the y-axis to where we are in lockdown, you see a significant reduction in economic impact. A lot of our work actually mirrors what Professor Mushfiq had seen. You go from 100% of what you were able to operate at to about 30%. But the trade-off is much lower number of cases, about 10% of what you'd see in the baseline. On the opposite axis, on the x-axis, if you were to say, let's continually open up the economy, which we're starting to see South Africa do, we're starting to see Ghana do, and move across the x-axis where you're able to shield and protect the most vulnerable populations, you'd be in somewhere like scenario E, where the total number of cases would still be very high. The total economic activity would still be very high, but you're able to greatly reduce the severity of cases, the percent of severe cases. And the case for shielding is this. I will end you on this imperative. Number one, if you're able to shield, which is what Governor Nasir is so effectively doing by maintaining lockdowns and thinking about the most vulnerable populations, you reduce the capacity constraints on the healthcare system, which at the beginning of this I said is very low to start with. The second thing you do is that we buy ourselves time to better understand the interactions of the virus and other susceptible populations. So when you think about physical distancing and what it would mean for things to spread very quickly in our economies, in informal sectors, or informal settlements in particular, where you have physical distancing is leaving your home, is what happens in informal sectors, right? In Kibera, I was speaking to one of my good friends, Kennedy Odede, yesterday. So Kibera has a population of 500,000 to 1 million people, depending on which villages you count. The density in Kibera is 2,200 people per hectare. In New York, that's 600 to 800. So there's almost 4 times the number of people in the same amount of space in Kibera. So if we're able to effectively do shielding, then we're able to understand the spread of the virus with comorbidities in areas like informal settlements, where we just don't have the capacity to handle a crisis of the magnitude that we're seeing in Spain or Italy. And finally, the third thing that shielding allows you to do is it allows you to open up your economy and get those jobs, the vulnerable jobs, try and protect them in some way, shape, or form. And we've started to do a lot of thinking, I'm happy to talk about that a bit later in Q&A, on how you would think about reopening your economy. There's definitely a demographic element to this and a geographic element to this as well. So if you think about in Nairobi, are there specific neighborhoods where you say you can contain the viral spread? If you can contain the viral spread, then you can begin to look at options and sectors that you can open up. Essential services stay open, but what does it mean to open up manufacturing in one part of Nairobi, where the factories are an industrial area, when workers are commuting in from other areas? So we really need to think about the intersection of some of these issues as we think about reopening the economy. And I'll end there, right? The 3 things I shared is, number one, the imperative to protect lives is paramount. And really ramping up our testing strategies is a critical part of being able to understand the magnitude of this problem and then mobilize resources accordingly. The second thing is about safeguarding livelihoods. With all the fiscal stimulus that we're asking for from the international community and being announced by our governments, we have to make sure that they hit jobs for SMEs in order to really make a difference. And finally, we need to really find our path in balancing these 2 imperatives because this virus might be with us for a while. And so we need to find sustainable ways to balance those 2 imperatives.